Hello, my name is Dr. Eldred Taylor, and I'm an obstetrician gynecologist that was trained at Emory University in Atlanta. I did my undergraduate work at Vanderbilt University, and I've been practicing obstetrics and gynecology since 1990 here in Atlanta, Georgia. However, probably about 8 years into my practice, I discovered that maybe I wasn't helping my patients as much as I thought. And this really came home, it really became apparent to me when my wife began having issues that seemed to be hormone related, but I really didn't know how to help her as an obstetrician gynecologist. I was really somewhat embarrassed because my wife was having difficulty sleeping. She was very emotional prior to her menstrual cycle, had awful PMS, and just wasn't very happy. And in my attempts to try and make her better, I did what I knew to do, is birth control pills, antidepressants. And because I was living with her, we figured out that it wasn't working. And really, because my wife is also a physician and a psychiatrist, we both went on a journey to try and figure out what was actually causing the problems. And actually, my patients helped to educate me because they were asking me questions about bioidentical hormones. And initially, I really didn't want to hear about it. But I took some information home, and my wife actually listened to the information, and she said, honey, you need to look at this. And that started me on a road that I've been on for the last 14 years, trying to understand how the body's hormones and how the body functions normally, to try and figure out what tests to do, to try and figure out what the abnormalities are, correct those abnormalities, and allow the body to heal itself. The definition of a physician is a person who is skilled in the art of healing. And to heal something, usually what you do is you find out, if you have a broken bone, what you do is you try and test to see which bone is broken. And then what you have to do is you have to put the bone back in line. And then after you put the bone back in line, the body does the rest. And that's what we do with hormones and we do with nutrition, is we test to figure out what is out of line. We try and give the body what it needs to repair itself, and then you take your hands off and let your body heal itself. And so that is what I have been interested in over the last 10 to 12 years. That's how I treat my patients. And over the last 8 years, I have been around the country and actually around the world teaching docs a new way of looking at medicine. Is not looking at disease-based medicine, but instead looking at medicine as trying to figure out the cause, put whatever is out of line back in line, and then allow the body to do what it needs to do. I try and practice what we call physiologic medicine, and not pharmacologic medicine. Pharmacologic medicine is you list a bunch of symptoms and we give you a medicine to try and cover up the symptoms. Physiologic medicine means we try and figure out what is the cause, and then we try and give the body what it needs so that physiology can take over. Because physiology, the body is amazing. If you can give the body what it needs, it makes it so much easier for me and for you to get better.